All right, good morning, everybody. I'd like to give a thanks to the previous presenters. That's great stuff we're here today. Gonna end the day off with a light topic, and that's gonna be on combating the rising suicide rate in Black Americans. All right, the main reason I have for presenting this topic is awareness. Without awareness, this problem is not gonna be fixed, anytime soon. And just out of curiosity, how many of you are already aware that the suicide rate in African Americans was rising over the past few years? Okay, cool, you guys, nice. Yeah, that's good to know. And for those of you who didn't know, this whole reason I did this research, just to make people more aware of this. And the fact is, according to the CDC, suicide rose in Black Americans by 26% from 2018 into 2021. And that's in comparison to the white population, which actually had 3.9% decline in that same time. And today we're basically just going to be talking about a couple of the primary factors that I found for this rise and some potential solutions to help combat this issue. And in order, we will go from racial discrimination to access to mental health care and community-based solutions. All right, so let's start with racial discrimination. Establishing the relationship between racial discrimination and mental health is a complicated task, to say the least. But discrimination is a fact of life, in many of the Black communities, so it's a good place to start. Racism has been proven to be a stressor that leads to worse mental health outcomes. This is contrasted with the fact that depression and anxiety tend to exhibit lower rates in African Americans, and they generally report having less feelings of depression and anxiety, and Black Americans have reportedly had lower suicide rates than white Americans. It's still important to note that depression and anxiety don't necessarily correlate with higher suicide rates. It's actually because can be seen in the gender gap, actually. Women usually report higher levels of those symptoms, but the suicide rate in men is higher in every ethnicity. Lots of reasons I don't have time for, but depression and mental illness, there's still leading indicators for suicide, so it's important to mention still. And as far as going back to discrimination, systemic racism is a good place to start when talking about the effects of racism on African Americans' mental health. The racial history of the United States, ranging from police practices to housing inequality to higher poverty rates, these all lead to lower quality of life, and therefore lower mental health outcomes. Tying it directly with trauma, 65% of young African Americans report having traumatic experiences, and that's in comparison to 30% of other ethnic groups. But the question is why it's only leading to higher suicide rates now? And one reason could be resources used to cope with these stressors have started to decrease in the Black community. I don't mean medical resources, that's something that I'll get into a little bit later. But more informal ways like religion, family dynamics, things of that nature. Actually, one phrase that sticks out with me about suicide, it has for a long time. Couldn't find a specific author, just a quote I saw on a forum one day. But basically it's that suicide is not a direct action necessarily. It's the result of pain outweighing resources to cope with pain. And I think that's largely what's happening here. Ways that Black community has historically dealt with these stressors has started to decrease. And so what's the solution to all of this? Continuing to fight for better police practices, housing equality, income equality, fighting racism and whatnot. These are all good steps to take forward. They won't fix everything, but they're definitely worthwhile. And another area is also focusing on racial equality in the mental health space. It's actually what I'll get into right now, and access to mental health care. All right, so it's been shown that white healthcare providers tend to have a more positive view of white patients compared to Black ones. And this is particularly alarming because while Blacks usually report having a lower rate of depression and anxiety, they tend to exhibit more extreme and longer lasting symptoms among those who do develop depression and anxiety. The reasons for this range from the fact that Blacks tend to have lower rates of continuation of care, for lots of reasons, related to cost or location, things of that nature, and also misdiagnoses. Depression and anxiety often exhibit in different ways in Black youth, such as aggression and irritability. This comparison to white peers who tend to exhibit the more like traditional signs, isolation, sadness, lack of interest in activities, things of that nature. But Black youth are still just as vulnerable, to suicide. So it's important to address this gap. And basically, this 15-year-old Black kid, he may not need anger management treatment. He might need anxiety treatment. So addressing those discrepancies is going to be important going forward. And also just increasing what's called a cultural competency. Basically, this is training physicians and providers to unlearn some of their conscious or unconscious biases and getting them to see how a patient's ethnicity and history and other life hardships are unique to being a minority, can affect your mental health. And because the fact is, Black people do seek mental health treatment, but it usually comes in the form of emergency departments, not necessarily mental health specialists. And there's lots of stigmas in the Black community around seeking mental health, and a lot of this is because of historically poor treatment, by mental health spaces in African Americans. So overall, we just need to find ways to make these spaces, make these providers more welcoming to the African American community, and also ties into things like socioeconomic status, like Blacks usually have lower rates of insurance coverage. Addressing these problems as well is going to help with equality in this space. And lastly, got community-based solutions. So most of the research I've found has led to the same conclusion, and that's that the key to avoiding or to solving most of this comes down to focusing on community resources. And what does it mean exactly? Starting with firearms, it's put plainly by the researchers of one particular study. State gun prevalence was strongly tied to firearm suicide in both Black and white men. And firearms are the most lethal means of attempted suicide. In addition, states with the lowest risk for firearm suicide also had the most restrictive gun laws. So this kind of is almost like cut and dry solution, I guess you can say. More restrictive gun laws will lead to lower rates of firearm suicide. And as far as tying this to a community-based solution, especially here in Chicago, there's lots of organizations that focus on curbing gun violence. And one thing we can do is also include suicide prevention as part of this message. It's definitely going to be important for us. Religion's also important to mention. I can go an hour on this alone, but religion does serve a unique purpose, in the African American community. Has been, for centuries. And basically, one thing we can focus on is, including things like church outreach as part of mental health treatment. This could be a way to better help connect with the community. And lastly, got other non-traditional intervention methods, finding ways to promote mental health outreach in places that Black people tend to congregate and feel safe, such as like barbershops or Black youth organizations, after-school programs. Going back to the cultural competency section, putting more research and funding into meeting African Americans where they are, it's going to be necessary going forward. One reason for the decline in the suicide rate in white Americans over the past few years has been a decrease in stigma. Just talking about this problem more and just decreasing these stigmas over the past few years, and something that this message needs to the Black community as well. And basically, to wrap up for us, obviously, extremely complicated topic, and it's going to take years to address this. But we've kind of just taken the resilience of Black Americans in hard times for granted over the past few years or all of history. But in order to fix this, but it's clear something's hard to give. So in order to fix this, you're going to need to have conversations like this. keep promoting research from these hardworking social scientists to address this topic. And thank you for listening. Yeah.